Welcome to another episode of the NEI podcast. I'm Dr. Sabrina Siegel, live at the NEI Congress 2022. In this extended Q&A episode, we take some time to sit down with one of our incredible speakers and allow the audience a chance to have their unanswered questions addressed from selected presentations. In this special episode, we're on site at the beautiful Broadmoor Resort in Colorado Springs. In this episode of the NEI podcast, I have here with me Dr. Mary Kimmel, and she just finished her amazing presentation, No Woman, No Cry, Advancements in the Diagnosis and Treatment of Postpartum Depression. Welcome, Dr. Kimmel.
Thank you. I'm really glad to be here.
So in this episode, we get a chance to have you answer some of the questions that the audience didn't have a chance to submit in time during or just after your presentation. So I'm really excited about this. The first question we have is, how frequently should you be seeing a pregnant patient to monitor postpartum?
Oh, that is an excellent question.
Yeah.
Definitely, I think this is a population where we need to be giving them more support. So seeing them more often than you might at other times in their lives. But also you're trying to find that right balance with them. And so it really is very individualized in terms of, and of course, also depends a bit on telehealth versus in person. Right. I think with telehealth, it's been much easier for me to see my patients, even some of them for a little while, once a week or even every couple weeks. But so I would build that in to know that when you are seeing, I often say to patients when they're like in the third trimester, we start talking about what will make sense postpartum and how soon do they want to check in with me. I like to do a soon check-in, but also recognizing that postpartum depression can evolve over time. Right, and so even if they're feeling well in that first visit, just to keep an eye on them.
What percentage of postpartum depression have baby harming impulses or thoughts?
Oh my gosh, I think what's hard about that is that actually most parents have the occasional, kind of odd thought or the occasional thought of, I'm giving the baby a bath. What if somehow I just suddenly walked away? And so that's actually the norm and is the norm across individuals. But for some individuals, I almost feel like their mom tendencies are even stronger. And so when they have that thought, they can't just push it aside. And so that's when they get stuck in those thoughts. And it also sometimes can be that they are, it's hard. You may have a hard time being present. And I think that's also when sometimes those thoughts come, is because you're not feeling as present.
Okay. What are your favorite go-to resources for information? For example, do you endorse the Hale Medications in Mother's Milk reference book?
Oh, LacMed is one that we often tell, mother-baby risk, but the LacMed is often the one we often start with.
Okay.
And from the NIH. And also, I will say a lot of times what I will do is I often will just do a quick check to kind of see if there's anything new out there.
Okay.
But that's also where you can also, call, for example, the PSI warm line. Your patient could call if they had questions.
Okay. What percentage of mood disorders postpartum are a result of a thyroid disorder?
Oh, I don't know the statistics on that, but I do know that I think it's an area that we probably underreport, undertreat. And so, there is good evidence, for example, in Verily Bergink's group, looking at even hypothyroidism as it relates to postpartum psychosis. And I have definitely taken care of several patients that had both directions, either an elevated kind of thyroid hormone or a low thyroid hormone. And that was clearly actually contributing to their symptoms. So I think it's something we should be testing in our patients and making sure we're optimizing.
Okay. While new agents are being developed, would you support the use of progesterone in the treatment of postpartum depression or postpartum manic states?
So this is a complex one because in some ways, I just got done talking about allopregnanolone. And so you can see where, the thought is that this, you have these high levels of estrogen and progesterone at the end of pregnancy, and that for some women, they are really sensitive to that drop. And so the idea of giving allopregnanolone or brexanolone is that you are, kind of helping with that drop. And so the allopregnanolone being that, so the idea being if we gave progesterone, does that also increase allopregnanolone? There are some women that are sensitive to progesterone. And actually what you'll see, some women describe that they'll have several weeks before their menstrual period, for example, where they'll have worsening of mood. And that may actually be because of the imbalance of progesterone to estrogen during, for example, the premenstrual period. And so postpartum, we're kind of seeing that same, and actually people who have more symptoms early in pregnancy that's often a group that is more sensitive to that. Progesterone's higher before estrogen catches up. Okay. And so I think the problem with giving progesterone is that there are some women that you're actually going to be kind of making more irritable or sort of tip that balance. So we don't tend to do that. And what I will say is some of our medicines like sertraline seem to work within that system. So even if there is that sensitivity, we have to remember that it is this complex system. And so even our psychotropics may actually be sort of buffering that.
Okay. Can you give allopregnanolone postpartum to prevent depression?
So the prevention piece is a very good question. And, we even talked about for some individuals that giving that SSRI doesn't necessarily prevent them developing postpartum depression. And so I think we just need more study. I think this is an area where, we're starting to understand this and study to be able to identify the people where it might be beneficial for them. And then, and there may be other people where there are going to be other things we need to do.
Right. The next question is there a warning for paroxetine in pregnancy?
There is still continues to be a black box warning for paroxetine. I will say, I think, again, it comes back to, risk. So if you have a woman or a pregnant or postpartum individual who paroxetine is the thing that has kept them well, I think there's a strong risk of taking them off of that.
Okay.
But it is why we I don't tend to use it as much.
Okay.
And I will also say, I think, our studies, are really helpful, but also it's hard to study these things and hard to kind of get that individualized risk for some of those things.
Right.
For like the cardiac issues.
Can you discuss prescribing antidepressants during pregnancy and which medications are good or not good?
Yeah, so I had written kind of an algorithm. On my talk, I said there isn't an algorithm that we can necessarily go by, but I have used an algorithm where, if you have a patient who you feel like medication could be beneficial, you've had a conversation together and they are ready to, they really feel like they need, for example, they've done therapy, but also, they know that they've done well with medicine in the past, or they know that their family member has done well with medicine and are ready to try medicine. If they haven't tried anything, I will often start with sertraline, and that's because it is very, we think it is even less likely to get across the placenta and into the breast milk. But having said that, I think, again, you're using what you would, in some ways I want you to also think about what is the best thing for this individual. And so, if they have a sister who's done really well or dad who did really well on escitalopram, then you may go with that. If that's been the thing that's helped them in the past in college, per se, and now, they're having an episode, they're beginning to have depression again, you go back to that. Bupropion. I mean, you kind of think about all these things, any one of them. And certainly I often use sort of the STAR-D algorithm. And so for, if they're not responding, then we think about the next level or we think about augmenting. And so I'm often using what you do outside of pregnancy, just having more of a conversation with the patient about, I think you really just have to give even more space to that conversation.
Okay. That sounds like very good advice. And, and it seems like it is very challenging, this whole topic that we're talking about, which takes me to my next question, which is, do you have any recommendations for preventing postpartum psychosis in high-risk bipolar patients?
Yes. So there is some good data of, for example, a group out of the UK who has looked at starting lithium pretty soon after delivery. So if you have a patient who has had a history history of postpartum psychosis, a patient who has, then that I often have that conversation with them in pregnancy about whether that might be something we do. We also, I would say, again, going back to, what is the thing for a patient with bipolar disorder who's had history in the past, go back to the things that have helped them in the past.
Okay. And that takes me to my last question, which is, should breastfeeding patients pump and dump at a certain time when the level of medication will be the highest in breast milk?
We don't tend to recommend that because it makes for a lot of complexity for mom. And the fact is that it probably doesn't make that much of a difference. And as I had been saying in the talk, we have evidence. We have to say there is a risk. There is an uncertainty, but it really is that risk. It is the risk of uncertainty. We don't often, with many of our medicines, have a clear place we can point to of a risk. And so we often, breastfeeding can be hard enough as it is.
Okay. Well, thank you so much, Dr. Kimmel, for all of this great information and for answering these questions for us today. And thank you for being on our show.
Thank you.
Thank you so much for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today.